Thank you for joining us for Ask a Therapist, a Blue Cross Blue Shield of South Carolina series in which we speak with mental health professionals about many issues many people face every day. I'm one of your hosts, Sean Jackson. Today we're joined by Dr. Fox to talk about anxiety and different ways to cope with anxiety, what exactly anxiety is and isn't. And it was a really great conversation. So let's jump right into it. All right, Dr. Fox, thank you so much for joining us today on Ask a Therapist. How are you?
I'm good, man. Glad to be here.
Absolutely. We appreciate it. I know today we're going to be talking about anxiety specifically. And I understand that is an area that you have some expertise in. So I'm really curious personally. Can you explain for me what is the difference between true anxiety versus just kind of everyday stress or nervousness?
Yeah, that's a great question. And actually, it's really just a matter of severity. I mean, everybody experiences anxiety and stress and things like that. Those are that's a natural emotion. Think about, if you had to give a presentation or take a big test or things like that, you're going to feel anxiety and it's going to, it's going to be there. That's pretty normal. When we talk about an anxiety disorder or anxiety that leads up to something that maybe needs to be dealt with more aggressively, you're talking about something that is just kind of either excessive to the situation that really prevents you from being able to engage in the activity, or something that doesn't seem to go away. If we experience anxiety around giving a presentation, once the presentation is over, it normally goes away and you go about your business. And anxiety that sort of builds up to that more clinical level is something that either becomes so overwhelming in that moment that you can't even execute the presentation, or even after that's done, you can't seem to come back down off of it. You're maybe stuck ruminating about it or worrying about, maybe even the next time, something like that. And it's just a persistent and consistent level of worry, fear, anticipation of something that may or may not happen again in the future.
Makes sense. So you kind of answered my next question already, but are there, say, physical symptoms that may be able to help somebody identify, between the anxiety disorder and just kind of that normal stress?
Yeah. So certainly there is sort of that, there's a lot of a cognitive part of that. So the excessive worry, the rumination, those kinds of things. But oftentimes anxiety also comes with, things such as sweaty palms, that are persistent. Like people that have consistent anxiety or an anxiety disorder may find that, they consistently have sweaty palms. Their heart races at different points, or out of the blue, they get this sort of rapid heart rate and rapid breathing. They may find it difficult to breathe at times. They can experience what we would normally consider a panic attack, which would be that really acute, just very physical, rapid heart rate. That we were talking about, this sort of sense of impending doom. Something, many people will confuse a panic attack with a heart attack because they may experience that tightness in their chest. They may actually experience some physical pain. There's a lot of GI issues that come with chronic anxiety as well. As you can imagine, if you're stressed and nervous, then you have that sense of butterflies in your stomach, but it also could turn into, you have, stomach pains or things like that kind of are unexplained by other, physical things. If you're experiencing some of these physical symptoms and, you go to the doctor and they can't find an actual biological, physical cause, then the next place to start looking is, okay, where is that anxiety level? Where's that stress level for you? And is is it now starting to manifest in some physical symptoms like that? So that there are lots of things that can kind of come from that. And, people can have elevated blood pressures and cardiac issues that aren't really explained by other things, but certainly anxiety, certainly persistent anxiety over time really can start to manifest in those physical symptoms. And if that's the case, that's definitely a red flag to say, okay, I really need to attend to this, probably more from how do I deal with and learn better coping strategies for my anxiety.
Yeah. I've heard before that, stress can do a funny thing to the body. And I imagine that getting into those type, physical symptoms where, you have no idea what's going on, that has to be a really, really scary thing. So with that being said, are there other kind of common triggers or anything else of anxiety?
So, there are, you can have anxiety that sort of is just a generalized, it's kind of always there. It may have been something that you were even born with. So it doesn't necessarily have to have a trigger. And I think that's one of those things that is baffling for a lot of people, that they're like, I was just sitting there and all of a sudden, I feel this sense of anxiety, this overwhelming sense of dread, and I don't really know why. There's no rhyme or reason. But absolutely, there can be some real triggers to it. So, people who have experienced traumatic events or had even witnessed, significant events, they don't even have to have been necessarily, firsthand part of it. Then there can be things that trigger that sense as well, if they have a similar experience or they anticipate that experience. Anxiety is one of those things that really kind of seems to, I hate to use the term, but it kind of preys on our worry about what may happen and becomes very overgeneralized, right? So we can have a situation that maybe doesn't go the way we want it to, and then that plays on the idea of the next time we're in that or a similar situation, we find ourselves like, oh my gosh, is this going to happen to me again? And it builds up, and it almost becomes a little bit, in some instances, like a self-fulfilling prophecy. We expect it so much that then it manifests, and lo and behold, we're paralyzed by the anxiety that we're dealing with. And I think one of the things to keep in mind is everybody's experience with this is a little unique. So what may be really anxiety provoking to one person may not be for the next. And as somebody may have different resources, different coping resources, or different ways that they sort of look at a situation, that's gonna mitigate how much of the anxiety they really experience. And so, I think we also have to be really careful that somebody that says that, I'm having anxiety or I have anxiety around this certain issue, that we don't sort of dismiss it because it doesn't seem reasonable, because that doesn't do it to me. Like, I don't mind doing public speaking, but I understand that there are a lot of people that is the worst thing in the world for them to have to be put into a situation like that. And it really has to do with how we appraise that situation and what our own personal resources are. And those kinds of things can then lead into, bigger issues as well that sort of, if they overwhelm our resources, then they just do. And the issue then becomes, addressing that from a standpoint of mitigating the symptoms and adding or developing new coping strategies that they can use to help kind of deal with those types of situations.
Yeah, no, totally. So that raises a few questions for me. I do think it's common or really easy for it to, for people to dismiss anxiety, because it's absolutely one of those invisible things, right? And like you said, like, oh, well, that doesn't bother me, so there's no way it should bother you. So for those types, I'm morbidly curious, how common is anxiety as a disorder?
It's actually really, really common, and we're finding it more and more. Certainly, as we come out of the pandemic, it's one of those things that seems to be on the rise. I think I read a recent article in the human resources field talking about the fact that I think it's well over 50% of the workforce has experienced some at least moderate levels of anxiety within like the past year and a half. And about that same amount are also experiencing some level of burnout, which is, burnout is sort of sort of the outcome of that long range stress that you experience. And it's very much related to anxiety, albeit a little bit more focused and tends to be a little bit more longer term chronic as opposed to like a panic attack or anything like that. But it's very common. It particularly when we think about coming out of the pandemic and we're in sort of an era in our world that is kind of now being termed an era of what they call permacrisis. And there's a lot of factors that are involved here. You've got, access to social media and 24-hour news cycles and things like that are constantly kind of hitting us with, whether it's the pandemic and the health scares that came out of that, and then followed with a lot of the political, upheaval and radicalization on both sides. So I'm not picking sides here, but it kind of happens on both sides. And then we've got the financial issues with the economy that are hitting people and the civil unrest that came out of all that. And it seems like it's just been one thing after another. And so, those are real things that impact people at different, in different levels, but it's also a little bit of a constant barrage. We haven't really had a period where we felt like we could kind of, just sort of get some calm, adjust to what life is like before the next thing happens. And so we're seeing a significant rise in anxiety because of that.
Right. That's really interesting. And I hadn't considered, even the effects of the pandemic and just the outfall that it's still having. Right.
Right.
So knowing that all that is coming, we do have, that barrage of social media throwing all of the negative stories at us, 24/7. How can anxiety, how does it affect people's kind of daily lives, would you say?
Well, it can do several things. It kind of is unique to the individual, but some of the things that we see, like I mentioned to you, burnout. We're seeing higher rates of burnout. People are feeling less engaged, less productive at work, things like that. We're seeing an increase in absenteeism and need for breaks and things like that away from work, where there may be different levels of stress and anxiety. But also we're seeing, I think we talk about the fallout of the pandemic, and one of the things that, and I don't want to get too far ahead, but one of the things that tends to be a real mitigator for anxiety is kind of social connection. And so the more people we can kind of connect with and build relationships with, it tends to be one of those things that helps us manage and deal with, that chronic anxiety and stress that gets thrown at us. And because of what's happened and our world's become so much more virtual and people work virtually, we've lost a little bit of that connection. And, I see this in my practice, particularly with young people. They left school, they had to do that virtually. Many of them have maintained or continued that because of whatever the circumstances are. And in some cases, because of that and the rise of technology and social media apps and things like that are meant to kind of keep us connected, what it's actually done is it's almost impeded our ability to have real relationships with people, face to face. And so a lot of I work with a lot of young people in my practice, and they really struggle with just how to build and maintain those relationships. And that adds another layer to that anxiety, because now you're isolated, or you may not even feel isolated, but you kind of are, because you're not, you have very, if your whole social connection is based on, Instagram and TikTok and things like that, those are very brief interactions that don't really build depth in a relationship. So,
right. So what do you think the difference is? Social media, like you said, is good for, kind of connecting people with like-minded people. And, you hear really good stories about relationships and things being developed via social media. Mm-hmm. And so what do you think the difference is between that and an in-person relationship?
I think it goes back to that depth. I think social media, and I'm not here to bash social media. I think it has its place, and it can do some great things, and it can keep us connected to people from a distance that we wouldn't have any connection with, because we don't have the ability to have those in person. I think it becomes problematic when it substitutes for the in-person relationship, because you can only get to know what that other person allows you to see on social media. It doesn't really give you the depth. You and I might connect on a social media platform, and we might share some thoughts and ideas and laugh at some jokes or whatever, but it really doesn't give us that opportunity to have shared experience, or to really understand, like, get to know you from a standpoint of what's important to you, what do you value. It doesn't give me an opportunity to share some of the things that might be bothering me, to understand and get that validation back from you to say, listen, I go through that too. Now, it can do that, but that's not what it is used for predominantly. And oftentimes, unfortunately, what happens is it becomes a source of, in essence, the doom scrolling kind of thing, where what you get bombarded with are all the negative things. And unless you go seeking, that support of those more positive things, it can be very easy to kind of follow a rabbit trail that ends up just kind of overloading you with like a negative impression of the world and life. And then you turn it off, and it's like, well, now I feel completely disconnected, because this is the only connection I have, versus, having relationships with people where you actually, get to know them on a much more intimate level, and understanding how to do that, and how to have those types of relationships. It's just a different way of interacting that that technology only allows us to have those brief kind of snippets, and having that depth is kind of missing from that.
Right. Yeah. Yeah. I think there's value to being able to look somebody in the eye. It's really hard for eyes to lie about what's going on in life, but very easy to kind of hide behind the keyboard. And, like you said, just only show people what you want them to see. So that makes total sense.
And then get validated. If I only show you part of it and somebody agrees with that, then that's what I'm going to continue to show. And I'm not going to be vulnerable, and I'm not going to show you the other side, or if I don't hear anybody else saying, hey, I'm dealing with this, or hey, what do you think about this, or I don't like this, then they're not going to share that, right? So I'm not going to share anything intimate, because who knows where that's going to go, and what kind of comment I'm going to get back. I think there's also a thing, human touch is important, and I don't mean this in any kind of sexualized way, but there is power in shaking somebody's hand, in getting a hug, whatever, that is just cannot be replicated. And those are all kinds of things that I think have seen a decrease in as technology and the world, unfortunately, the pandemic forced us, into this world. But we unfortunately have in some ways kind of continued some of that out of probably necessity in some places and convenience in others. So
definitely convenience. I've seen that for myself.
Right. I mean, we're all victim to it. I'm not immune to it either. But I think understanding that when it comes to that anxiety, and one of the best ways to manage anxiety is to have close connections and social relationships. That's been a hallmark of kind of managing anxiety for generations. That's not something new. So we just have to. I think we have to be cognizant of that and really look at and be intentional about kind of really nurturing those types of opportunities to have those relationships.
Thank you to the listeners for tuning in today. This has been Ask a Therapist, a Blue Cross Blue Shield of South Carolina podcast where we dive into mental health topics. Be sure to check out other episodes of Ask a Therapist for more mental health advice, and we look forward to seeing you on the next one.